The TMJ TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ TMD Demystified podcast.
Hello, TMD warriors. Good day to you, whether it's morning, noon, or evening. We are gathered for the next episode of TMD Demystified, and I am Tony Urbanek. Today, the topic for discussion is entitled Successful TMD, TMJ treatment depends on patient compliance. That is a fact, and I think it needs quite a bit of discussion, explanation. Very, very important from what I have now found out after personally treating thousands of patients with this disorder, both surgically and non-surgically. As some of you know, my history goes back for the first 36 years of my career. I treated this problem surgically and performed well over 2,000 temporomandibular joint surgical procedures, half of them open joint procedures through incision in front of the ear, and half of them through an arthroscope. And then the last 12 to 14 years of my career, I have limited the treatment of TMD to non-surgical care. And I can make judgments, I think, on that based on those patients. The non-surgical care in the last 14 years has eclipsed well over 4,000 patients personally, not including the network providers, the doctors who use our device and protocol and system of treatment now throughout the United States. That's just my personal experience. Boy, I'm not bragging because it has been an experience, both sides, both the surgical and non-surgical. But I have a really good feeling for what's going on with TMD from the surgeon's point of view, the non-surgeon's point of view, the patient's point of view, for sure. Based on this broad experience and also based on my broad academic experience and 50 years of dealing with patients, I have come to the conclusion that more than most, or maybe more than any kind of procedure or service given to patients, the patient's compliance with the protocol that we use to treat TMD is most important, extremely important, critical, because the technology of using a device that simply separates the back teeth, posterior teeth, allowing the mandible to retrude to centric relation without any pressure, without any direction, and unloads the joint simultaneously. If you allow the mandible to go back to centric relation and you unload the joint by unloading the posterior teeth according to the protocol 24/7 for 2 months and nighttime only the rest of your life, has extremely successful results based on university study in the 90+% basis, as long as the patient will follow the protocol. And I tell this to our patients constantly. It is preached by the other doctors in the network provider system, but probably not enough. In fact, I have come to the conclusion that I have not done a good enough job in educating the patient as to the importance of the protocol and patient compliance. Although it has been emphasized, it is discussed thoroughly. But as time goes on, I have been paying more attention to really what makes the difference between a successful treatment protocol, or like even a moderately successful treatment protocol, versus an extremely successful protocol versus no success at all, which is frankly very, very rare if the patient uses the device at all. But I can say, again, with that authority, based on well over 4,000 non-surgical cases performed using the device and protocol, that it is critical, highly dependent, that if you want that 90, 95, 100% success rate of decrease in symptoms, not generated by what the patient says how much better it is. The question is always asked, the standardized question is, what percentage of all of the original symptoms are now diminished or gone? That patient may have 2 symptoms, patient may have 12 of the usual and customary symptoms of TMD: frequent or recurring headache, earache, jaw pain, neck pain, subjective hearing loss, vertigo, tinnitus, upper back and shoulder pain and tightness, arm, hand, finger tingling, numbness, and various kinds of locking. Those are the well-established. There are some other symptoms which I won't delve into, but we are finding that there are ocular symptoms associated that diminish, then associated with and diminish when you diminish inflammation in the temporomandibular joint. So it's all about decreasing inflammation in the joint, not where the disc is, not whether the disc is damaged one way or another, whether it has a hole in it, whether it's anterior dislocated, how much degenerative change of the bone is present. It is all about how much of the inflammation is decreased in the joint, which will actually diminish the symptoms. And again, unloading the joint and putting the patient back into a centric relation actually decreases inflammation, chronic inflammation in the joint. Now, we have found that the device itself is time dependent. If you only use it occasionally, or you only use it when the patient wants to use it, you don't necessarily get the best results. You can get some results, and some patients are satisfied with some results, but we're not. We pay very, very close attention and document and monitor our patients as far as we can get them out to find out, what percentage of their original symptoms are diminished or decreased according to that original question that I just stated. What percentage overall, on average, of your original symptoms are not diminished or decreased in any point in time as we take the patient through the protocol? As I've talked about many times before, our biggest problem actually is not providing the service or getting the results. It's being able to document the results, because once the patient is satisfied that they have adequate results, whatever that means to them, they won't come back. We can't get them back. We call them up. We beg them. Oh, no, I'm fine. I don't need to come back. We hear that so often. In fact, those patients are in the majority that may come back once and document that 70% of their symptoms are gone at 3 weeks, and then we can't get them back after that. Not surprising, dealing with people as patients, they more often than not take the least complicated or the quickest way to or through a solution, not necessarily the best. I'm not complaining, I'm just telling you the way it is. And we want to make sure that what we do and the way we perform as service providers, as doctors, that we can document and prove that what we do and what we say is accurate. And when patients don't follow the protocol, frankly, it can make us look bad because we're not getting the results that we can. Now, this is not just limited, obviously. If you are a healthcare provider, you know for sure that patients always take the quickest way through, the easiest way out, any kind of treatment they possibly can. But in other kinds of services, it is not so much dependent on the patient following the protocol as it is in this particular case, in this particular device and protocol. You know, if you do surgery, and I did almost 48 years of maxillofacial reconstructive surgery, there was very little I had to depend on as far as patient following my protocols post-surgery. I did want them to take the antibiotic. In a lot of cases, because I was taking apart the facial skeleton, putting it back together, and they were wired together for a while. And a lot of patients didn't want to stay wired together for 6 weeks, and a few, did the unthinkable, which is in the middle of a healing process after orthognathic surgery, and taking the facial skeleton apart and screwing it and plating it back together, they unwired themselves, which certainly can create problems, but that was very, very, very infrequent. And although patient might have complained about this, that, or the other, they were forced to follow the protocol, which was staying wired together for usually about 6 weeks in most cases, sometimes less. Doing joint surgery, once they left the operating room, there was little that I asked them to do, except, take their pain medication and take their antibiotic, and it all worked out well. And, in most doctors, they know that they prescribe a prescription, a drug, a pill for someone, and some of them follow the directions and some of them don't. But in this case, if a patient expects to have a high level of success in using the device, they must follow the protocol all the way through. And again, let me define the protocol, which is 24/7 for the first 2 months, except when you eat. And usually that will take, an hour or so per day, 20 minutes per meal, eat 3 times a day, roughly. And then nighttime only or sleep time only for the rest of your life. And what the objective is to allow, by unloading the joint enough, allowing the inflammation to decrease, which does slowly, and it decreases at variable rates between patients. And inflammation is certainly a very complicated issue. It's not simple itself, but we do know that inflammation will decrease under its own powers if you quit antagonizing the joint, in this case, temporomandibular joint. So you unload the joint like a set of crutches unloads a bad knee. The inflammation goes down at variable rates, but slowly, not overnight. Patients will get responses, and the average response, now that we can delineate from our studies, internal studies, show that at 3 weeks, the average patient who follows the protocol will get 70% of the symptoms to go away. And at 2 months, which is now a full 2 months, 24/7, except when the patient eats, the average is 86%, and it goes above that once we get them into nighttime only and things settle down. Those are the average numbers. So the success is extremely high. On the other hand, there's a whole large group of patients that we can't get back, that we can't include in the study, but I can tell you that if they continue to have pain, they would be back in the office. And when patients don't get the results that we expect, more often than not, like 90% of the time, it's all about the patient has not followed the protocol. And it is increasingly amazing to me and my colleagues who use the device and protocol, and my associate in the practice, to listen to the patient's justifications for not doing the protocol, if they justify it at all. You can talk with the device nicely in your mouth, and if you get your tongue off of it and start out, when you begin wearing it, this is what I educate patients with all the time, start out slowly. Do not try to talk as fast. You don't have to educate your tongue on where to put it. Just speak slowly for the first few days. Your tongue will get used to it. That is one of the number one justifications about not wearing the device 24/7. I can't speak with it. Well, they refuse to just slow down and get their tongue used to forming the S's and the T's, which is really the only issue. Form the S's and T's correctly, and the speech comes out just fine. And the way to do that is to slow down your speech so that the tongue gets used to being placed in the proper place with the device in place, and then you can speed up. It only takes a few days. But some patients refuse to do that. And then they come in and I say, I can't wear this at work because people make fun of me or I talk funny. And I say, all you have to do is slow your speech down somewhat and you can talk perfectly. But again, we're dealing with human nature, whatever that is. And that is not what I'm here to discuss today. But sometimes it's very disappointing, very surprising, sometimes humorous, and sometimes a lot less than humorous to look at a patient who themselves have sometimes extreme symptoms, but won't go the mile to help themselves. And that is what we're dealing with. And do not misconstrue what I'm saying as a complaint. It is my attempt to educate others as to how to properly use the device. And then more importantly, how to emphasize educating the patient on the importance of using the protocol. Protocol was worked out by experience, and many hundreds of patients that were examined and followed up on, which determined the best protocol by far is to start out 24/7 for 2 months, which allows the inflammation to decrease slowly, and then a continuation of that use of that device, but not 24/7, because if you go beyond 2 months, there is a possibility you can get super eruption of teeth. We don't want that, but not in the first 2 months, not when they're chewing every day for an hour. They have it out of their mouth at least an hour a day, 24/7, let's say 23/7, because they got to eat, does not allow posterior eruption of posterior teeth. It can allow the retrusion of the mandible back to centric relation, creating a bite problem, but that is the definition of a functional malocclusion, not movement of teeth. And there is a lot of misconception by others or criticism of others of the possibility of that. When it's not movement of teeth, there is an original functional malocclusion present that the patient has learned to posture their mandible forward so they can get the teeth together. But as soon as you get them out of occlusion, posterior occlusion, the symptoms start to diminish, but they begin to exacerbate or show occlusal problems, anterior open bites, and things like that should have been corrected in the first place. I have seen many patients who have gone through two. I've seen many patients who have gone through two separate orthodontic treatment plans, many just one, but many two, and still have a functional malocclusion, which allows the mandible to go back to centric relation and the teeth don't fit together. That is a orthodontic problem, which needs to be corrected by the orthodontist in their educational process and understanding process. But all this comes into play and all comes down, focuses down, and focuses on the fact that it really is dependent on patient compliance, patient cooperation. And the only way to do that is with appropriate and complete and thorough patient understanding. And they get understanding through education, whether it be verbal, be written, through consistency, times over equals certainty. I have had so many disappointing experiences where I know that I've talked to a patient about using the protocol, how to use the protocol, the importance of using the protocol several times, and they come in and admit that they haven't followed the protocol correctly. And usually the disappointing fact is they're not necessarily getting the complete resolution to their symptoms. Although I can tell you by our internal evaluations that the average decrease in average symptom decrease at 3 weeks is 70%, 86% at 2 months. And then above that, if the patient is following the protocol. So there are two parts to this, and then I'll just wrap it up. Because just to complain about the problem is not what I'm here to do. I'm not here to just complain about what I've observed, what I see. If you're going to do that, then save your breath. What we need to do here is, number one, give the patient proper instructions and education. And I think this needs to be included to do that in writing, in detail, exactly what the protocol is, why the protocol is important, what to expect with the protocol, and if you don't follow the protocol, what happens? And then put the onus on the patient itself. And then following the patient along to make sure that the patient follows the instructions correctly and completely. It's never going to be a perfect system. I don't expect it to be a perfect system. But in our case, we have a lot of respect for what we've discovered here. We have a lot of need to disseminate what we know, and the solution for TMD, a real, predictable, successful, non-surgical, FDA cleared, university studied, validated treatment for TMD that, when used correctly, followed correctly, gets amazing results consistently. So patient compliance. And so it's our responsibility. It's not, if you are a network provider, if you are a potential network provider, if you are any kind of healthcare provider, if you are just doling out services, non-surgical services, surgical services, mechanical services, and you don't think that educating the patient is part of what you do, then you need to go back and rethink it. Because literally, I tell patients half of what I do is to educate them as to what the process is, what TMD is all about, what the solution is, how it works. And I literally spend half my time with my patients, with my consultations, explaining to them, educating them to their level of understanding. And that's another issue. Some people pick it up really fast. Yeah, some people are smarter than others. Some people are a little duller, and you have to monitor and gauge your communication with them on the level and to the level that you think that will get best across to them. Use the proper terms, use simpler terms, do not use doctor terms. But the point is, it is our responsibility as healthcare providers to educate the patient as to what we're doing, why we're doing it, what to expect, and what's going on, and certainly to answer their questions. But if you don't do adequate education, they're not even going to be able to ask you decent questions. So that is, in our case, treating TMD, what I have observed for sure, that the most important part of a successful treatment is patient compliance. What we do to increase vertical dimension on patients that have less than ideal results is an easy to understand mechanism. It's easy to do. If you're not getting results, that's one of the first things you do is you increase vertical dimension, but that is majorly secondary to what I've observed as the difference between a successful treatment, non-surgical treatment, and a very successful treatment. It's really boiled down to it in my experience with all those thousands of patients, is the how well we can get patients to follow the patient compliance. With that stated, we're going to leave it there. I know I've made the point. I hope you apply it to what you do as a professional, as a healthcare provider, hopefully as if you are a provider that provides TMD care, especially using the Urbanek device and protocol, because we have the stats, we have the studies, we know how well we can do when we can gain patient compliance. I encourage you to think about it. I encourage you to join our network if you'd like to. You can learn more about it at www.urbanektmj.com. If you'd like to contact me, be happy to communicate with you. I'm available at tony@tmjservices.net. I look forward to the next time that you visit. I appreciate your attention to this episode. I look forward to the next time I get to speak with you. I am Tony Urbanek, and this is TMD Demystified.